Dr. Marcus Whitfield's voice echoed through Massachusetts General Hospital's emergency wing as he hurled a bloody surgical towel at 24-year-old Darius Cole's feet. "Clean this mess up, boy." The renowned cardiovascular surgeon's $800 designer scrubs couldn't hide the ugliness beneath. "And try not to contaminate anything. God knows your kind barely passed the GED." Darius looked up from his mop bucket, his dark brown skin glistening with sweat from the night shift. His janitorial uniform hung loose on his lean frame. Night shift, double shifts, whatever kept the lights on in his grandmother's Roxbury apartment. The ER's harsh fluorescent lights cast shadows across his tired face, highlighting the exhaustion around his eyes. "I said clean it." Whitfield's fist slammed against the nurse's station. The crash cart rattled. Medical supplies jumped. "Unless you're too stupid to understand basic instructions." The ER fell silent. Nurses shifted uncomfortably. A first-year resident pretended to study charts. Dr. Sarah Chun, head of emergency medicine, looked up from her tablet but didn't intervene. Whitfield was untouchable. 500 successful surgeries this year, $1 million donations to the hospital foundation, personal friends with the board chairman. Behind Whitfield on the examination screen, CT scans glowed with intricate patterns of blood vessels and tissue. Patient charts scattered across the desk showed test results that had stumped 3 different specialists over 6 hours. The 16-year-old girl in room 7 was dying, and nobody knew why. Whitfield smirked, certain he'd put the janitor in his place. He had no idea his world was about to shatter. Darius Cole didn't argue. He didn't complain. He simply reached down, picked up the towel with his gloved hands, and dropped it in his biohazard bag. But his dark eyes moved past Whitfield to the CT scan on the monitor. His expression changed. Not confusion. Recognition. "That scan," Darius said quietly, his deep voice steady. Room 7. The 16-year-old girl with the undiagnosed abdominal pain. Whitfield's smirk faltered. "Excuse me. You're looking at her pancreas, but you should check her celiac axis. That shadow pattern at approximately 12 o'clock position, 3 centimeters from the superior mesenteric artery. It's not a tumor like your differential diagnosis suggests." The ER went dead silent. Every eye turned to the young black man holding a mop. Dr. Chin stood up slowly, her tablet clattering to the desk. She'd been studying emergency medicine for 15 years and recognized advanced radiological interpretation when she heard it. "What did you just say?" Whitfield's face reddened. "Median arcuate ligament syndrome," Darius continued, pointing to the screen without touching anything. "The celiac artery compression. The patient probably has pain after eating, weight loss, and nausea that worsens with deep breathing. Her pain likely began approximately 8 months ago, but intensified in the last 6 weeks." Dr. Chin pulled up the patient's chart with shaking hands. That's exactly her symptom progression." "How did you?" "Lucky guess," Whitfield sputtered. "You probably overheard doctors talking." But Darius wasn't finished. "If you check her case file, you'll see that her lipase levels are borderline elevated, not because of pancreatitis like your notes suggest, but because the vascular compression is causing ischemic damage. The lactate dehydrogenase will be slightly elevated too, around 300 units per liter. And if you do a duplex ultrasound during expiration versus inspiration, you'll see the velocity increase by more than 50%, confirming dynamic compression." Dr. Chun was already pulling laps. Her Korean-American face went pale as she read the results. "LDH is 315, she whispered. Everything he said, it's matching. The girl in room 7 had been hours away from exploratory surgery that would have found nothing and potentially killed her. Whitfield's phone buzzed. Then again, the ER's overhead system crackled to life. "Dr. Whitfield, cardiology consult needed in ICU. Patient deteriorating rapidly." "I'll handle it," Whitfield snapped, gathering his tablet. But his hands shook as he pulled up the ICU charts. A 52-year-old man, post-op day 3 from routine bypass surgery, suddenly crashing. Blood pressure tanking. Labs showing nothing obvious. The ICU was chaos when they arrived. Monitors screaming. Nurses prepping emergency medications. The patient's wife sobbing in the corner, her mascara running down her cheeks. "Talk to me," Whitfield barked at the ICU resident. "I don't know, sir. He was stable 2 hours ago. Now he's in distributive shock, but no obvious source. No fever, no infection markers. Cultures are negative. Pericardial tamponade," Darius said quietly from the doorway. He'd followed to empty the ICU biohazard bins, his cleaning cart visible behind him. Every head turned. Impossible, Whitfield said. We'd see it on echo. The resident already did one. Not if it's posterior. The clot is probably isolated to the posterior pericardial space, compressing the left atrium. Standard parasternal windows won't show it. You need a subcostal view with the patient in steep reverse Trendelenburg position during deep expiration. Dr. Chen stared at Darius. That's an incredibly specific technique for a rare presentation. Do it, she ordered the ultrasound tech. 5 minutes later, the hidden clot appeared on screen exactly where Darius predicted. The patient was rushed to emergency surgery. His life saved with minutes to spare. But the hospital's emergency department computer system was lighting up with more alerts. 3 undiagnosed cases in the past hour. A woman with mysterious seizures. A child with unexplained bleeding. An elderly man with respiratory failure. Each time, different specialists stood baffled. Each time, Darius quietly observed from the background while emptying trash, mopping floors, restocking supplies. And each time, he saw what they couldn't. The seizing woman had posterior reversible encephalopathy syndrome from undiagnosed hypertensive crisis. Her blood pressure cuff had been the wrong size, giving false normal readings for her body type. The bleeding child had von Willebrand disease type 2B, a rare variant that standard coagulation tests miss. The elderly man had myasthenia gravis exacerbation triggered by the antibiotic his nursing home prescribed, a known but often forgotten drug interaction. By the end of the shift, Darius had diagnosed 7 cases that had stumped attending physicians with decades of experience. Dr. Chen followed him as he pushed his cleaning cart toward the service elevator, his sneakers squeaking on the polished floor. "Who are you?" she asked simply. Darius stopped, his hand on the elevator button. The hallway was quiet now, 3 a.m., the shift when hospitals hold their breath between emergencies. His reflection in the elevator's metal doors showed a young black man who looked much older than 24. "Nobody," he said softly. "Just the janitor." "Janitors don't diagnose median arcuate ligament syndrome," Dr. Chen said. "Where did you go to medical school?" Darius's jaw tightened. "I didn't." He pulled out his phone, a cheap Android with a cracked screen, and showed her a photo. A young black woman in a hospital bed, surrounded by life support equipment. Beautiful smile despite the circumstances. Her hair in neat braids, hospital gown covering her thin frame. "My sister Maya. She was 19. Sophomore at Howard University, full scholarship, pre-law. Wanted to be a civil rights attorney like Thurgood Marshall." Dr. Chen's expression softened. "She went to the ER with stomach pain. They said it was probably period cramps, maybe stress from exams. Sent her home with ibuprofen." Darius's voice cracked slightly. "She came back 6 hours later, unconscious. By then, her appendix had ruptured. Sepsis set in. She died 3 days later." "Darius, I'm so sorry. I was 16. I didn't know anything about medicine. But I kept asking the doctors questions. Why didn't they catch it? What were the signs? What should they have looked for?" Most of them ignored me. But one resident, Dr. James Park, he stayed with me in the ICU waiting room. He showed me Maya's charts, explained what went wrong, walked me through the cascade of failures. Darius opened his phone's notes app. Thousands of entries. Medical terminology. Disease pathways. Diagnostic algorithms. Years of accumulated knowledge. I started reading medical textbooks from the library, PubMed articles, Grand Rounds lectures on YouTube, free online courses from Harvard, Johns Hopkins, MIT. I couldn't afford college, dropped out of high school to help my grandmother after Maya died. But the internet didn't check my credentials. He showed Dr. Chun his browser history. Harrison's Principles of Internal Medicine. Up-to-date medical reference. The New England Journal of Medicine. 8 years of obsessive self-education. Every free minute between janitorial shifts. I got a GED, applied to college with a full scholarship essay about Maya. Got accepted to 3 universities, including Johns Hopkins. His voice went flat. Then my grandmother had a stroke. Someone had to pay her medical bills. Someone had to take care of her. Maya was gone. My parents were gone. Dad died when I was 10, Mom overdosed when I was 14. Grandma was all I had left. "So you became a janitor," Dr. Chen whispered. "In the only place where I could still learn medicine," Darius said. "By watching doctors work. By reading charts when they left them open. By studying every case that came through these doors." Dr. Chen's pager exploded with a trauma code. Before she could respond, the ER doors burst open. Paramedics rushed in with a 4-year-old boy, seizing violently on the gurney. The child's small body convulsed, his dark skin turning ashen from lack of oxygen. Multiple seizures, started 20 minutes ago. We've given lorazepam twice, no response. Parents say he was fine this morning, no medical history, no trauma. The child's body convulsed again. His oxygen saturation dropped dangerously low. 76%, 72%, 68%. Whitfield appeared from the doctor's lounge, called in for the critical case. Start phenytoin loading dose. Get an LP, CT scan, full metabolic panel. Stop. Darius's voice cut through the chaos. You do not speak in my ER, Whitfield roared, his face purple with rage. But Darius was already at the boy's bedside, looking at the paramedics' report. Did the parents mention any visitors? Anyone sick in the house? Any construction or renovation? The mother pushed forward, desperate. A black woman in her 30s, tears streaming down her face. Yes, my mother-in-law visited from Mexico 3 days ago. She's been coughing, but she said it was just allergies. This isn't a seizure disorder, Darius said. It's neurocysticercosis. The CT scan will show multiple brain lesions, calcified cysts from Taenia solium, pork tapeworm. The grandmother has tuberculosis, which suppresses her immune system, making her more susceptible to reactivation of dormant parasitic infections. The boy got exposed through close contact. Dr. Chin's eyes widened. If that's true, we're treating him for the wrong thing entirely. Anticonvulsants won't stop parasitic encephalitis. You're risking this child's life on the janitor's guess. Whitfield's face went purple. Then do the scan, Darius said calmly. But while you wait 20 minutes for radiology, start him on albendazole and dexamethasone. Because if I'm right, every minute you delay is causing more brain inflammation. And check the grandmother for active TB before she exposes the entire family. The room divided. Some staff looked to Whitfield, their established authority. Others looked at Darius, who'd already saved 7 patients that night. The young black janitor versus the renowned white surgeon. The battle lines were clear. Dr. Chin made the call. Start the medications. Stat CT scan. And someone call infectious disease. 18 minutes later, the CT scan lit up with the characteristic Swiss cheese pattern of neurocysticercosis. Multiple calcified lesions throughout the boy's brain. The infectious disease specialist arrived, studied the scan, and turned to Dr. Chun with amazement. Who made this diagnosis? This is incredibly rare in the U.S., difficult to catch early. Everyone pointed to Darius, who was mopping blood from the floor near the trauma bay. But the crisis wasn't over. The grandmother began coughing violently in the waiting room. Blood speckled her handkerchief, bright red against white fabric. The ER went into lockdown protocols. Multi-drug-resistant tuberculosis, Darius said, observing from a distance. Based on her immigration history and antibiotic resistance patterns in her home region, she'll need second-line treatment. And everyone she's had contact with in the last 3 weeks needs prophylaxis. The hospital's infection control team descended. 13 family members potentially exposed. 3 hospital staff members who'd been in close contact with the grandmother during intake. What could have been a citywide TB outbreak was contained because a janitor understood epidemiological patterns that the admitting nurse had missed. Dr. Chun found Darius in the supply closet an hour later. He was restocking gloves like nothing had happened. His hands moved efficiently, years of muscle memory organizing supplies. How many, she asked. How many what? How many patients have you diagnosed while mopping floors? Darius was quiet for a long moment. I stopped counting at 200. By sunrise, word had spread through Massachusetts General like wildfire. The janitor who diagnosed the impossible. The cleaner who saw what specialists missed. Hospital gossip moved faster than the electronic medical record system. Dr. Marcus Whitfield made phone calls all morning. His voice carried through his office door, angry and desperate. This is a liability nightmare. An uncertified, unlicensed individual practicing medicine in our facility. I don't care what he diagnosed. Yes, I understand he saved lives, but what happens when he's wrong? When a patient sues? When the medical board investigates? Exactly. We have protocols for a reason. By noon, Darius was called to the hospital administrator's office. Linda Martinez, chief operating officer, sat behind a massive oak desk with legal counsel flanking her sides. The hospital's attorney, Richard Brennan, looked like he'd stepped out of a corporate law commercial, silver hair, $5,000 suit, expression of calculated concern. Mr. Cole, Martinez began carefully. We appreciate your observations last night. Several patients benefited from your insights. But, Brennan interrupted, you are not a licensed medical professional. You do not have malpractice insurance. You are not credentialed by this hospital to diagnose or treat patients. What you did last night, however well-intentioned, constitutes practicing medicine without a license. That's a felony in Massachusetts. Darius sat quietly in his janitor's uniform, surrounded by people in power suits. The only black person in the room. His calloused hands rested on his knees. Massachusetts General Hospital cannot endorse or encourage this behavior, Martinez continued. We're grateful no harm came to any patient, but we cannot set a precedent where janitorial staff provide medical advice, even when doctors are wrong. Darius asked softly. Brennan leaned forward. That's precisely the point, Mr. Cole. Doctors have malpractice insurance, extensive training, and legal protections when they make clinical judgments. You have none of these things. If you had been wrong about that child, if you delayed proper treatment with your parasitic infection theory, this hospital would face catastrophic liability. But I wasn't wrong. This time, Brennan said sharply. The law doesn't care about your track record. It cares about credentials, certifications, and liability coverage. Do you understand the difference? Martinez softened slightly. Darius, we're not firing you, but we need you to focus on your assigned duties. Cleaning, sanitation, maintenance. If you observe something concerning, report it to the nursing staff, but do not directly advise medical personnel or patients. Whitfield's smug face appeared on Martinez's computer monitor via video conference. The boy's talent is admirable, but talent without proper channels is just noise. Maybe in 10 years, after medical school and residency, he'll make a decent doctor. Until then, he should stick to mopping. Darius felt the weight of institutional machinery rolling over him. 8 years of self-education, 200-plus correct diagnoses, lives saved. All meaningless against the wall of credentials and liability concerns. Do you understand, Mr. Cole? Martinez asked. Yes, ma'am. I understand perfectly. He understood the system wasn't designed for people who looked like him to break through without following every prescribed step. That night, Darius returned to his grandmother's small apartment in Roxbury. Rose Cole, 72 years old, sat in her wheelchair watching Jeopardy. The stroke had left her left side partially paralyzed, but her mind was sharp. How was work, baby? She asked, her voice slightly slurred. Fine, Grandma. Darius kissed her forehead and started preparing dinner. Rice, beans, chicken, $23 worth of groceries stretched across 3 days. You're lying, Rose said. I can always tell. What happened? Darius told her everything while cooking. The diagnoses, the confrontation, the legal threats. His grandmother listened quietly, the way she'd listened to his dreams since he was 16 years old. Your sister would be proud, Rose said finally. Maya always said you saw things other people missed, even when you were little. What good is seeing if nobody listens? Darius's voice broke. Baby, listen to me. Rose wheeled closer. They're scared of you. A young black man with no degree outsmarting doctors who paid $300,000 for their education? That terrifies them. Not because you're wrong, but because you're right. And if you're right, everything they believe about credentials and hierarchy falls apart. Darius served dinner on mismatched plates. So what do? What you've always done. Keep learning. Keep watching. Keep being ready. Because eventually, someone will need you so badly they'll have to listen. At 2:47 a.m., Dr. Chen's phone shattered the silence with the emergency code. She rushed to Massachusetts General, her heart pounding. The text was cryptic but terrifying. Governor's daughter. Undiagnosed. Critical. Need everyone. The ICU was already packed with specialists. Neurologists, cardiologists, infectious disease, gastroenterology, every department represented. And in the center bed, connected to a dozen machines, lay 17-year-old Jessica Bradford, daughter of Massachusetts Governor Patricia Bradford. The girl was comatose. Temperature 104.3 degrees Fahrenheit. White blood cell count through the roof. But every test came back negative. No infection. No inflammation markers matching any known disease. No toxicology hits. Nothing. We've been working on her for 18 hours, the ICU attending said, exhaustion clear in his voice. She collapsed at field hockey practice yesterday. Since then, she's deteriorated rapidly. We're losing her, and we don't know why. Governor Bradford stood in the corner with her husband, both looking devastated. Secret Service agents positioned by the door. News vans gathering outside. This was national news. Whitfield was already at the bedside, studying charts with 3 other department heads. Exotic infection? Autoimmune encephalitis? Toxic exposure? Dr. Chen scanned the room. Every brilliant mind in the hospital was stumped. Her phone buzzed. An unauthorized text from an internal number she didn't recognize. Check her sports bag. Specifically, her water bottle. DC. Darius Cole. Watching from somewhere. Even though he'd been ordered to stay away from patient care. Where's her field hockey equipment? Dr. Chen asked. What? Whitfield looked up, annoyed. We're trying to save her life, not inventory her belongings. Where is it? Dr. Chen's voice left no room for argument. Security brought up the sports bag. Inside, among shin guards in a uniform, was a metal water bottle. Dr. Chen unscrewed it and immediately jerked back. A faint, sweet smell. Send this to toxicology. Priority rush. Test for ethylene glycol and methanol. We already did tox screens, Whitfield protested. Not for chronic low-dose exposure, Darius said, stepping into the room. He wore street clothes, not his uniform. Off-duty, but unable to stay away. The standard tox screen checks for acute poisoning. But if she's been drinking small amounts over weeks, it'll present differently. Metabolic acidosis with an elevated anion gap, but the parent compounds might be mostly metabolized by now. You need to check for glycolic acid and formic acid metabolites specifically. Every doctor in the room turned to stare at the young black man who'd walked in uninvited. Who the hell are you? Governor Bradford demanded. He's nobody, Whitfield said quickly. Security, remove him. I'm the person who's diagnosed 200 cases your doctors missed, Darius said calmly. And your daughter is dying from contaminated water. That metal bottle has a manufacturing defect. There's a recall on that specific brand from last month. The interior lining degrades and leaches antifreeze compounds into the liquid. She's been poisoning herself slowly for 6 weeks, every practice, every game. That's insane, Whitfield sputtered. Then explain her kidney function, Darius said. Creatinine at 3.2 and rising. Calcium oxalate crystals in her urine. Visual disturbances noted in her initial presentation before she lost consciousness. That's optic nerve damage from methanol. The timeline fits perfectly with the start of field hockey season. Dr. Chun was already pulling up lab results. He's right. The crystals are there. We attributed them to dehydration, but start fomepizole immediately, Darius said. Ethanol for if you don't have fomepizole stocked. Sodium bicarbonate for the acidosis. Hemodialysis to clear the metabolites. You have maybe 4 hours before her kidneys fail completely. This is insane, Whitfield repeated, but his voice lacked conviction. Governor Bradford stepped forward. If there's even a chance he's right, do it. Do everything he said. Now, the medical team moved into action. 45 minutes later, toxicology called back. Elevated glycolic acid. Ethylene glycol poisoning confirmed. The water bottle's manufacturer had issued a recall 2 weeks ago, but the Bradford family hadn't seen the notice. Jessica Bradford stabilized within 3 hours. By morning, she was conscious. By afternoon, she was asking for her phone. Governor Bradford found Darius in the hospital cafeteria, eating a $4 sandwich. She sat down across from him without asking, her Secret Service detail maintaining distance. You saved my daughter's life, she said simply. Why? Because she was dying and I knew what was killing her. The doctors told me you're a janitor. No medical degree. No license. That's correct. Why aren't you a doctor? Darius told her about Maya. About his grandmother. About choosing family over ambition. About 8 years of teaching himself medicine from the margins. Governor Bradford listened without interrupting. When he finished, she pulled out her phone and made a call. Dean Morrison? Patricia Bradford. I need to talk to you about a special admission to Harvard Medical School. Yes, I know applications closed 6 months ago. I'm calling in that favor you owe me. His name is Darius Cole, and he just saved my daughter's life. No, he doesn't have a bachelor's degree. Yes, I'm serious. You're going to meet him, and then you'll understand. She hung up and looked at Darius. You have a meeting with Harvard Medical School's dean tomorrow at 9 a.m. He'll want to test your knowledge. Think you can handle that? Darius's hands trembled slightly. Governor, I appreciate this, but I can't afford Harvard. And I can't leave my grandmother. Full scholarship, housing stipend, and we'll arrange home health care for your grandmother, paid for by a discretionary grant from the governor's office. Non-negotiable. Why would you do this? Because the system failed my daughter. The credentialed experts with their fancy degrees almost let her die. You saw what they couldn't. And I've spent my career in public service watching talented people get crushed because they don't fit institutional molds. Governor Bradford stood up. I can't fix the whole system, but I can fix this. Tomorrow, 9 a.m. Don't be late. The next morning, Darius walked into Harvard Medical School's administrative building wearing his only suit, a thrift store find that didn't quite fit right. Dean Morrison waited with 3 department heads and a battery of medical examinations. Mr. Cole, the dean began skeptically. Governor Bradford is a persuasive woman, but Harvard Medical School has standards. We've never admitted someone without a bachelor's degree, and we've certainly never. Test me, Darius said simply. For 6 hours, they did. Anatomy questions from second-year medical students. Clinical scenarios from board examinations. Diagnostic puzzles from grand rounds. They showed him CT scans, EKGs, lab results, patient presentations. Darius answered everything. Not just correctly, but comprehensively. He explained not just what diseases presented, but why. He discussed treatment algorithms, drug interactions, cultural considerations in patient care, ethical dilemmas in emergency medicine. By hour 4, the department heads were leaning forward, fascinated. By hour 6, they were asking him questions about their own research. Dean Morrison finally held up his hand. Enough. Mr. Cole, in 30 years of medical education, I've never seen anything like this. Your knowledge base exceeds most of our second-year students, and your clinical reasoning rivals our residents. But, Darius said, hearing the hesitation, but you lack the foundational science education. Biochemistry, molecular biology, genetics, these aren't things you can learn from YouTube. You'd be starting with significant gaps. Then I'll fill them, Darius said. I've been filling gaps my whole life. The room fell silent. Finally, the head of admissions spoke. There's historical precedent. In the 1800s, some physicians trained through apprenticeship rather than formal education. We could structure your admission as a special category, provisional enrollment, with mandatory summer remedial courses. He'd have to prove himself within the first year, another professor added. Standard academic probation protocols. Dean Morrison studied Darius for a long moment. Why medicine, Mr. Cole? After everything the system has put you through, why still want this? Darius thought of Maya, of his grandmother, of the 4-year-old boy seizing from parasites, of Jessica Bradford slowly poisoning herself while doctors looked everywhere except her water bottle. Because people are dying from preventable causes, he said. Because the system misses things. Because someone needs to look at patients the way I do, not just as collections of symptoms, but as human beings whose lives depend on doctors being right. 3 days later, Darius received his acceptance letter. But Dr. Marcus Whitfield wasn't finished. He'd spent the week making calls, rallying opposition, preparing for war. A janitor attending Harvard Medical School? It was an insult to everyone who'd earned their position through proper channels. He organized a petition. 47 doctors signed it, demanding Harvard rescind the admission. He contacted medical boards, licensing agencies, news outlets. His campaign had a simple message: standards matter. Credentials protect patients. Shortcuts are dangerous. The story exploded on social media. #JanitorDoctor trended nationally. Opinion divided sharply. Some celebrated Darius as proof that talent transcends circumstances. Others called it a dangerous precedent that undermined medical training. Talk shows debated it. Think pieces dissected it. Medical journals published editorials about admissions standards versus demonstrated competence. Through it all, Darius kept working his janitor shifts, saving for his grandmother's care, preparing for the biggest transition of his life. Dr. Chen visited him during a night shift 3 weeks after the governor's daughter incident. How are you holding up, she asked. People I've never met have opinions about whether I deserve to exist in medicine, Darius said, emptying a trash can. It's surreal. For what it's worth, the ER staff took a vote. 32-5 in your favor. The 5 who voted against you all work day shift and have never actually seen you diagnose anything. Darius smiled slightly. What about you? I recommended you for a fast-track residency position at Mass General upon graduation, Dr. Chen said. Pending successful completion of medical school, obviously. The department head approved it this morning. Dr. Chen, you saved 17 lives that I know of, she interrupted. The hospital's statistical analysis shows mortality rates dropped by 12% during your shifts compared to when you weren't working. 12%, Darius. Do you understand how statistically significant that is? I was just trying to help. That's what makes you different from Whitfield. He practices medicine for prestige. You practice it for patients. Medicine needs more people like you. Harvard's orientation was held in a historic auditorium with carved wood panels and portraits of distinguished alumni. Darius sat among 165 incoming medical students, the only one without a bachelor's degree, one of only 12 black students in the class. Dean Morrison addressed them from the podium. Look around you. These are the people you'll learn with, struggle with, and eventually practice alongside. You come from different backgrounds, but you're united by one thing. You've all earned your place here. Some students glanced at Darius. Their expressions ranged from curiosity to skepticism to outright hostility. After the ceremony, a white student named Brad approached him. So you're the janitor everyone's talking about. Must be nice to skip the hard part and get a pity admission. Darius didn't respond. I spent 4 years at Princeton, 3.9 GPA, scored 522 on the MCAT, Brad continued. But hey, maybe I should have dropped out of high school and pushed a mop instead. Seems like an easier path. Brad Morrison, Dr. Chin's voice cut through the confrontation. She'd been invited as a guest lecturer. If you'd like to compare clinical knowledge with Mr. Cole, I'd be happy to proctor an examination. Right now, if you're confident. Brad's face reddened. That's not necessary. I thought not. Dr. Chin smiled coldly. Perhaps focus less on your classmates' qualifications and more on your own studies. First-year anatomy is notorious for humbling, overconfident students. The first semester was brutal. Darius was right about the gaps in his foundational knowledge. Biochemistry pathways he'd never formally studied. Genetic mechanisms he'd only understood superficially. Molecular biology that required laboratory experience he lacked. He studied 18 hours a day. While other students socialized, he was in the library. While they slept, he was reviewing lectures. His janitor's work ethic transferred perfectly to medical school's demands. But he excelled in clinical reasoning. When professors presented diagnostic cases, Darius saw patterns others missed. When they discussed treatment protocols, he asked questions that made professors pause and reconsider. Dr. Patricia Okonkwo, professor of pathology, pulled him aside after class. Mr. Cole, your written exam scores are middle of the pack, but your clinical intuition is extraordinary. You see disease differently than students who learned from textbooks first. Is that good or bad? Darius asked. It's rare, she said. Most students learn to think like doctors. You already think like one. We just need to fill in the academic foundation. By December, Darius ranked 15th in his class overall. But in clinical skills assessment, he ranked first. By March, he'd climbed to 8th overall. The gaps were closing. Then came the practical examination. Real patients, real diagnoses, real-time pressure. Students rotated through stations, examining patients, and presenting findings to attending physicians. Darius's patient was a 45-year-old woman with vague abdominal complaints and weight loss. 3 previous students had examined her. All 3 suggested gastritis or ulcers. Darius spent 20 minutes taking her history. Where she worked, what she ate, who lived with her, her hobbies, her recent travel. You have a cat, he said finally. The woman looked surprised. Yes, too. How did you know? The scratches on your forearms are feline pattern. And you mentioned your babies are picky eaters. Combined with your job as an elementary school teacher, high exposure to various pathogens, and your recent adoption of one of those cats from a shelter 3 months ago, I want to test for toxoplasmosis. The neurological symptoms you mentioned, headaches, confusion, combined with abdominal pain, and the timeline of cat adoption suggests possible acute infection. You're immunocompromised, aren't you? The woman nodded slowly. I have lupus. How did you? Your facial rash. Mild, but characteristic malar distribution. You mentioned joint pain in multiple small joints symmetrically. That's likely why previous exams focused on gastric issues. They assumed your abdominal pain was related to NSAID use for the arthritis. But immunosuppression from lupus treatment makes you vulnerable to opportunistic infections like toxoplasmosis. The attending physician observing the examination stood up abruptly. That's correct. This was a standardized patient case designed to be extremely difficult. You're the first student to diagnose it correctly. Word spread quickly. The janitor-turned-medical student wasn't just surviving. He was excelling. 4 years later, Darius Cole stood in the same auditorium where he'd begun, wearing a white coat with Dr. Cole embroidered above the pocket. Graduation day. His grandmother sat in the front row in her wheelchair, tears streaming down her face. Governor Bradford attended, keeping her promise to see this through. Dr. Chun was there, smiling proudly. Even Dean Morrison approached afterward. Dr. Cole, he said, shaking Darius's hand. "I owe you an apology. I doubted whether you belonged here. You proved me profoundly wrong. You gave me a chance when you didn't have to," Darius said. "That's more than most people did. What's next for you?" "Residency at Mass General. Emergency medicine, where I started." But the story doesn't end there. Because Dr. Darius Cole's first day of residency coincided with Dr. Marcus Whitfield's career crisis. An investigation had revealed Whitfield's pattern of misdiagnoses and shortcuts. Patients harmed. Complications swept under the rug. The surgeon who'd mocked a janitor was now facing medical board review. They met in the ER hallway. Whitfield looked older, humbled, carrying boxes from his emptied office. "Cole," he said quietly, "I owe you an apology." "Yes, you do. I let my ego blind me. I saw your skin color and your job title, and I assumed I was better, smarter, more worthy." Whitfield set down his boxes. "You saved lives I would have lost. You saw things I couldn't, and I tried to destroy you for it." Darius studied the man who'd once called him boy and thrown bloody towels at his feet. "The question is," Darius said finally, "what are you going to do now?" "I don't know. Maybe I'm not meant to be a doctor. That's not for me to decide. But I learned something from watching you fail. Talent isn't enough. Credentials aren't enough. What matters is whether you can set aside ego long enough to actually help people." Whitfield nodded slowly. "For what it's worth, I'll spend the rest of my career trying to make up for the damage I caused, including to you." As Whitfield walked away, Dr. Chun appeared beside Darius. "You didn't have to be kind to him." "No," Darius agreed. "But Maya would have wanted me to. She always said the system doesn't change through revenge. It changes when people choose to be better than what hurt them." 5 years into his emergency medicine career, Dr. Darius Cole had become legendary at Massachusetts General. Not just for his diagnostic accuracy, though his save rate remained the highest in the department, but for something else. He started the Hidden Talent Initiative, a program identifying brilliant people working in hospitals' margins. Janitors who'd been doctors in their home countries. Cafeteria workers with advanced degrees. Security guards fluent in languages the hospital desperately needed. The program provided pathways, licensing exam preparation, credential evaluation assistance, scholarship applications, mentorship from doctors who understood what it meant to fight through institutional barriers. Miguel Santos, the night janitor, turned out to be a neurosurgeon from Venezuela. His credentials weren't recognized in the United States, but through Cole's program, he's now completing his residency. Aisha Mohammed, cafeteria worker, held a pharmacy degree from Somalia. She's now the hospital's cultural liaison for East African patients, improving care quality dramatically. James Park, the resident who'd once helped a grieving 16-year-old understand his sister's death, became the program's co-director. "You know what's remarkable?" Park said to Darius one day. "We've certified 47 people in 5 years. That's 47 brilliant minds that were invisible until someone looked." Today, Darius stood in front of a congressional committee investigating healthcare disparities, invited to testify about accessibility in medical education. "My story isn't unique," he told the assembled politicians. "Right now, across America, talented people are working jobs that don't reflect their potential. Not because they lack ability, but because they lack opportunity. Because the system demands credentials they can't afford. Because implicit bias makes institutions overlook them." He showed statistics. Immigrants with medical degrees driving taxis, PhDs working retail, multilingual geniuses earning minimum wage because their paperwork doesn't fit institutional boxes. "We talk about healthcare workforce shortages," Darius continued. "But the workforce exists. We're just not looking in the right places. We're not asking the right questions. We're not giving chances to people who don't fit traditional molds." Senator Williams, an older white man from Texas, interrupted. "Dr. Cole, with all respect, don't standards exist for a reason? Can't we protect patient safety and maintain accessibility?" "Senator, I nearly died from appendicitis because an ER doctor dismissed my symptoms as drug-seeking behavior. I was 14, black, and from a poor neighborhood. She saw my skin color and assumed the worst. That's what happens when we prioritize credentials over humanity." He held up his phone, showing Maya's photo. "This is my sister. She died because doctors didn't take her pain seriously. If someone, anyone, had listened to her the way I learned to listen to patients, she'd be alive. Standards don't save lives. Attention saves lives. Compassion saves lives. Willingness to look beyond assumptions saves lives." The chamber was silent. "I'm not suggesting we eliminate medical training," Darius continued. I'm suggesting we expand pathways into it. I'm suggesting we evaluate people by demonstrated competence, not just pedigree. I'm suggesting that talent whispers in every language, from every background, and wisdom wears every uniform. The hearing ended with bipartisan support for the Medical Workforce Opportunity Act, federal funding for alternative pathway programs, scholarship support for non-traditional students, credential recognition reform for immigrant professionals. But the real impact came from individuals watching the hearing on C-SPAN. A hospital administrator in Seattle started asking maintenance staff about their backgrounds. She discovered 2 former engineers, a chemist and a physician. A medical school dean in Atlanta created a special admissions track for people with demonstrated clinical experience but non-traditional academics. A mayor in Detroit launched a citywide program connecting talented immigrants with professional mentorship and licensing support. The ripples spread. 3 years later, Dr. Darius Cole received the MacArthur Fellowship, the Genius Grant, $625,000 to continue his work breaking down barriers in medicine. He used it to establish the Maya Cole Foundation, named after his sister. Full Ride Medical. Share this if you believe potential has no prerequisites. Comment about a time you discovered hidden brilliance in someone others overlooked. Support programs that create pathways for non-traditional students. The Hidden Talent Initiative and Maya Cole Foundation continue expanding nationwide, providing pathways into medicine for overlooked individuals. Links in description if you want to turn inspiration into action. But remember, the most powerful change happens when each of us decides that credentials matter less than compassion, pedigree matters less than potential, and traditional paths matter less than transformational impact. Because talent whispers in every language. Wisdom wears every uniform. And genius shows up wherever humans choose to truly see each other. Dr. Darius Cole started as a janitor, but he was always a doctor. He was just waiting for the world to catch up.